Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll walk through the methods for setting target heart rate. Setting a target heart rate helps ensure we dose exercise appropriately and safely. To set a target heart rate, we commonly use one of two methods. The first is the percent of maximum heart rate method. The second is the heart rate reserve method, also known as the Karvonen method. Now, let's start with how to calculate target heart rate using the percent of maximum heart rate method. First, we calculate the patient's maximum heart rate using the formula 220 minus age. Second, we select the desired exercise intensity. These percentages are based on guidelines from the American College of Sports Medicine. It is more common to use ranges, but for quick estimates, we will start with midpoints. The percentages for each level of intensity are 60% for low or light, 70% for moderate, and 85% for high or vigorous. Lastly, we multiply the maximum heart rate by the selected intensity to find the target heart rate. Now, let's walk through an example for this method. Your patient is a 40-year-old. To calculate the maximum heart rate, we will take 220 minus 40, which equals 180. That is their max heart rate. Then we select the desired intensity. In this case, we want to set it to moderate. This means we will use 70%, or 0.70. Now, take 180 times 0.70. which gives us a target heart rate of 126 beats per minute. So the key steps are, calculate max heart rate, choose the desired intensity, and multiply to find the target heart rate. Next, let's walk through the process of calculating target heart rate using the heart rate reserve, or Karvonen method. Overall, this method is typically considered more accurate because it accounts for the patient's resting heart rate. Step 1. Calculate maximum heart rate using the same formula, 220 minus age. Step 2. Obtain the patient's resting heart rate and subtract it from the maximum heart rate. This gives us the heart rate reserve. Step 3. Select the desired exercise intensity. While ranges are commonly used, we'll start with midpoints. For heart rate reserve, you will notice that the values differ from those obtained with the percent of maximum heart rate method. The intensities for heart rate reserve are 35% for low, 50% for moderate, and 75% for high. Step 4. Multiply the heart rate reserve by the selected intensity. Then add the resting heart rate back to determine the target heart rate. So the key steps are, calculate the maximum heart rate, determine the heart rate reserve, apply the intensity, and then add the resting heart rate back. Let's apply this with an example. First, we calculate the maximum heart rate using 220 minus age. For a 67-year-old, that gives us 153 beats per minute. Next, we calculate heart rate reserve by subtracting the resting heart rate. In this case, the patient's resting heart rate is 70. So we take 153 minus 70, which equals 83. This is the heart rate reserve. Then we choose our intensity. Using midpoints, if we want moderate intensity, we will use 50% or 0.50. Now we multiply heart rate reserve by the intensity. 83 times 0.50 equals 41.5. Finally, we add the resting heart rate back. That gives us 111.5 beats per minute, which we would round to 112 beats per minute. So the key steps are, calculate the maximum heart rate, use that and the resting heart rate to determine the heart rate reserve, apply the intensity, and then add the resting heart rate back.
That's it for this PT Micro Lesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.